Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel Erser College of Pharmacy. Today we are going to discuss about the continuation from preparation of monophasic liquid dosage form. In this video, we are going to learn about the preparation of monophasic liquid dosage form which is instilled into the body cavities and the liquid dosage form which is applied on the skin. First, we are going to discuss about monophasic liquid dosage forms which is applied on the or instilled into the body cavities. First is ear drops. Ear drops are the medicated liquid preparations which is instilled into the ear. They are used to kill bacteria and soften the earwax or to treat the middle ear infections. Usually, the ear drops are prepared using water, glycerin, propylene glycol, and alcohol as vehicles. Here, the water is less preferred since the ear secretions are fatty in nature. We are using glycerin and propylene glycol in most of the ear drops. Now, let's see an example for ear drops. That is boric acid ear drops. The ingredients which is used for the preparation of boric acid ear drops are boric acid, industrial alcohol, and purified water. First, we have to weigh the boric acid in and mix it with industrial alcohol. The boric acid should be completely dissolved in the industrial alcohol. After that, we have to add 3/4 of the quantity of purified water with that mixture and mix well. After mixing, we have to filter that and to remove all the undissolved particles. Next, finally, we have to add more water to make up the final volume. These eardrops are stored in a small, well-closed glass or plastic bottles with a dropper, usually an amount of 10 to 15 ml. Next is nasal drops. Nasal drops are also the drug preparations, which is a liquid form and it is instilled into our nostrils. The common drugs which are used in the preparation of nasal drops are anti-inflammatory drugs, sympathomimetics, and decongestants. They are used to relieve pain, act as an antiseptic, and also it may produces the decongestant effects. During the preparations, the nasal drop should be isotonic and it should be buffered to maintain the pH between 5.5 and 7.5. The viscosity should also be similar to that of the nasal mucus. These nasal drops are prepared as to resemble to our nasal secretion. The example for nasal drops is ephedrine hydrochloride nasal drops. The ingredients which is used in the preparation of these nasal drops are ephedrine hydrochloride, sodium chloride, chlorbutal, and water. Here, ephedrine hydrochloride is used as a nasal decongestant and chlorbutal as preservatives. For the preparation, first we have to take the chlorbutal and dissolve slowly in water as it is volatile in nature. To dissolve quickly, we have to dissolve it in the hot water. Next, we have to cool it. After cooling, we have to add both the sodium chloride and our active drug ephedrine hydrochloride. Mix well until it have to dissolve fully. After finally, we have to make up the volume with water, then filter it to remove all the undissolved particles. Next is the monophasic liquid dosage form, which is applied onto our skin. First is lotions. Lotions are the suspensions or emulsion or combination of both the suspension and emulsion, which is to be applied onto the unbroken skin without frictions. Usually, lotions and liniments are similar in nature, but they have slight differences. The lotion should be applied onto the unbroken skin without any frictions. For example, calamine lotion. The ingredients which is used in the preparation of calamine lotions are calamine, zinc oxide, glycerin, bentonite, liquefied phenol, and sodium citrate. In the preparation of calamine lotion, first we have to take calamine, zinc oxide, and bentonite and titrate it in a mortar and pestle. And we have to take the sodium citrate and mix it with the 3/4 quantity of rose water and add the solution with the titrated calamine, zinc oxide, and bentonite. In the other hand, we have to take liquefied phenol and glycerin and mix it to produce the required volume. Then we have to mix both the mixtures and to shake it to ensure the uniform distribution. After the preparation, both the mixtures are thoroughly mixed and the preparation is to be transferred to a bottle. Usually, these lotions are act as a topical protective and it also gives us the soothing effect. Next is liniments. Liniments are also the solutions or mixtures of various alcoholic solution of soap or emulsions, which is intended for the external applications. The liniments are differ from the lotions as we have to give some frictions while applying to the affected areas or to give some rubbing effect. These alcoholic liniments are generally used for their rubefacient, counter-irritant, astringent, and penetrating effects, and should not be applied on the broken skin. The example for liniment is camphor liniment. For the preparation, we have to take camphor, cottonseed oil. For the 1000 gram of liniment, we have to take camphor 200 gram and cottonseed oil 800 gram. During the preparation, first we have to take the cottonseed oil in a dry flask and kept in a steam bath. After the cottonseed oil get completely heated, we have to add the camphor to the stopper and we have to close the container securely. After the adding of camphor, we have to stop heating and dissolve the camphor in the cottonseed oil until camphor gets fully dissolved in the cottonseed oil. Usually, this camphor liniment is used to treat sprains, rheumatism, and other inflammatory conditions. Next is colloidions. Colloidions are the liquid pharmaceutical preparations which is meant for other external applications. Usually, these colloidions contains pyroxylene, which is nitrocellulose, which is dissolved in the mixture of ether and alcohol. It is when it is applied onto the skin, the solvents gets evaporates and it leaves behind a thin protective film. There are two types of colloidions. One is plain colloidion and another one is medicated colloidions. In plain colloidions, it has some additives without any medicated or active ingredients. For example, we have taken the flexible colloidions without additives. The ingredients which is used for the preparation of this plain colloidions are pyroxylene, ether, and alcohol. Here in that we does not add any active ingredients. In the preparation, first we have to take a dry closed container, dissolve the pyroxylene with a mixture of ether and alcohol. Stir until a clear viscous solution is formed. We have to store it in a well-closed container to prevent the evaporation of both the ether and alcohol. Usually it forms a protective film over the small cut and abrasions. Next is medicated colloidions. Medicated colloidions are similar to the preparation of simple colloidions, but it contains some medicinal substances. For example, salicylic acid colloidions. The ingredients used in the preparation of salicylic acid colloidions are salicylic acid, pyroxylene, ether, and alcohol. Here in this preparation, we have to add salicylic acid in alcohol and completely dissolve it. After that, we have to add ether towards that mixture and completely mix it. And finally, we have to add pyroxylene with it and continue stirred until a clear viscous solution is formed. And we have to store it in a well-closed container to avoid evaporations. Usually, these medicated colloidions are used to treat warts and wounds. Okay, students, today I hope we all have learned about preparations of monophasic liquid dosage form. Let's see in the next class. Thank you.